Thank you for being with us tonight. We start with a quick check on COVID-19 here in the state. 279 new cases were reported today and 12 new COVID deaths. The health department says they all had underlying conditions. Only one had not been hospitalized. The state remains at 68% fully vaccinated. The health department and Governor Ige say the state is heading in the right direction after last month's Delta surge. Cases, hospitalizations, and the positivity rate have all dropped while vaccination rates have gone up. So why are there so many cases still circulating in the state? Nikki Schenfeld follows up.
The state is in a much better place than it was a month ago, but some health officials say there are still too many people out there that are at risk of catching COVID, and we're not in the clear just yet. This time last month, the state was at its peak, recording over 1,000 cases and averaging about 900 daily. Today, cases and the 7-day average are below 300, but some health officials warn there is still a risk.
We're still seeing a significant amount of COVID transmission in the community because we still have hundreds of thousands of people who are not yet fully vaccinated. In fact, we have about 450,000 people in Hawaii residents who are not yet fully vaccinated.
According to state data, about 132,000 residents are eligible for the vaccine, but still haven't gotten it. More than 200,000 keiki are not eligible just yet, and roughly 119,000 still have not received their second dose. That leaves 458,000 people still at risk.
That's enough people that the Delta variant can begin to move around again.
He says tens of thousands of people are still in the waiting period to get their second shot, but tens of thousands haven't showed up for their second dose.
The first shot gives you some protection, but you really want to follow the science. Go get that second shot and get yourself fully protected against COVID-19.
The DOH says there have been 8,400 pediatric cases since the beginning of August. And while most children don't get severely ill, those not eligible to get vaccinated yet can carry and spread the virus.
The virus will continue to move around until it finds somebody who perhaps is susceptible to severe illness, and that can be bad news. So those of us who can get vaccinated, should get vaccinated, will help protect the youngsters who are not yet eligible.
Others have natural immunity, but health officials say vaccine immunity is more effective and lasts longer.
Over 5% of our population has had confirmed COVID, and I'm sure the number is much higher because we don't test everyone.
On Friday, Governor Ige extended the COVID emergency proclamation through November 30th. Green says 90% of the eligible population has at least one dose and thinks restrictions should be revisited in a few weeks to benefit the people who have gotten vaccinated.
When we go below 3% positivity rate, that's usually the standard to really pull back on restrictions, especially when your people are so well vaccinated.
He believes Delta has run its course, but
people have to be still sensible, but people are wearing masks indoors and are vaccinated, they're fine.
The health department says if the pandemic has taught us anything, it's that it's unpredictable.
450,000 people, it's way too many people to say that, the surge is over. We don't determine what herd immunity is. The virus determines what herd immunity is. And the virus, in many ways, has been in charge of this pandemic. The best way we can take charge of the pandemic is to go get vaccinated.
Nikki Schenfeld, KHON2 News, working for Hawaii.
Nikki, thank you.